Hello, I'm Dennis Pullin. One of my favorite parts about being president and CEO of Virtua Health is getting to know our colleagues and the many ways they are here for good. Each person contributes to healthy communities, and each person has a story to tell. Let's meet one. Erin, good morning. Welcome to Here for Good.
Thank you for having me.
Well, it's always great to see you. So you've spent a better part of 15 years at Virtua, specifically in the area of behavioral health, correct? So what initially drew you to this part of our field?
I knew in college I was going to school as a social worker, and I wanted to do something that was going to be helping other people, those that were less fortunate. And it was through an internship that I really was struck by the mental health population. I actually worked in children's crisis intervention inpatient unit for children. And that was my first taste of psychiatry and behavioral health, and I never looked back from there.
Did you ever think 15 years later you would still be in this particular space?
Absolutely. I think it was more called to me to come to it than it was a calling the other way around. I didn't know that psychiatry or behavioral health is what I wanted to do, and it continues to fulfill me every day.
I think all of us realize that behavioral health is a significant concern. Tell me a little bit about the landscape as you see it.
I see it as a spectrum, just like any other illness that we seem to face. I know that some children or adults are facing anxiety and depression, and then we have children and adults that are facing much bigger trials with trauma history, with mood illness, ADHD, psychosis, and other comorbidities that are impacting that as well. I think it runs the gamut.
It can also be stressful for the providers that are trying to provide care to patients with these particular type needs. What would you suggest to some of the providers to make sure that these patients, their needs are adequately met?
There's a couple of complexities to that. I know that when we are working with the mental health population waiting for an inpatient bed at one of our hospitals, there's a lot of fear. I think fear of the unknown, fear of not knowing what to say to a patient, fear of saying something that is going to incite them or upset them. And what I say to a lot of our staff is just meet them where they're at. Say hello and good morning. I think that we're so focused sometimes on talking to people that we're uncomfortable with that we just want to get to where we want to go with them and not just realize that they're human too.
So what you're suggesting is creating a safe space initially to be able to start a dialogue that hopefully will lead to a healthy outcome.
Absolutely. I think you said it really well. Meet them where they're at. Treat them with kindness the way that you would want to have anybody treat you or your loved ones, and know that you're going to get a better result because of it.
So I think a lot of clinicians are also looking for different types of tools to help their patients. And I know here lately, technology has become a big part of what we do in healthcare. And in this particular area, I know there's something called Wobot. Tell me about that technology, or if that is something that we're using that you're familiar with, and how patients might be able to benefit from that.
I know that Virtua and Dr. Kapoor have made a really great connection with Wobot. I will be honest, I don't know a whole lot about it, but I know that AI and opportunities for people to connect with services or apps that are going to help them identify certain symptoms or opportunities for treatment or coping skills to work with those symptoms are going to be great. It is something that I think is going to be interesting for people who may not want to sit down and talk to somebody face-to-face in a therapy session, but may be able to utilize those opportunities. I think as long as we are communicating with that person that this is something that you can help to use to support your treatment, but if this is not something that's appropriate or working for you, please, this is what your next steps are, or here is a number to reach out, or please come back to us and let us know. We will find you what you need.
So we've talked about our providers providing care for our patients on this journey that we've been on for quite some time to create this culture of we. One of the things that we've really wanted to focus on is care for the care providers. And I know there's a lot of our colleagues that deal with their own challenges of mental health and behavioral health related things. What would you suggest for our colleagues and how they might be able to take care of their own mental well-being?
I think the first thing is to continue to talk about it, to acknowledge it, to realize that your mental health is just as important as your physical and medical health. I think that we have started to break down that stigma, but I know that as an environment with colleagues, we sometimes are hesitant or concerned to open up and speak to somebody else about that. That is changing as well. I know that people have come into my office. I know that I've had colleagues reach out to me to say, I have someone in my office or there's somebody that needs help. CareBridge is obviously something that's available to us as colleagues. I have helped support colleagues try to find in-network and out-of-network services that are available to them or their family members. And I think that continuing to have the conversation and supporting the education of our colleagues about well-being is going to be fruitful.
Do you think we've made progress alleviating some of the stigma around mental health or behavioral health issues to where not just patients, but our own colleagues would feel comfortable seeking care?
I think we still have some ways to go. I do think that even through COVID, the opportunity for people in the public eye and then within our own health system with everything that we faced and watched and saw, encountered, or disengaged with because we weren't able to be together has really sparked more conversation around what that has done to our well-being. I do think that is an area where we can continue to focus, but the stigma on the truly mentally ill people of our area, I think, is still high.
So you've done really well answering my questions about other people. So let's turn it to you now. So what do you do to sort of maintain your own mental health? I know you have something that helps you to decompress when you're not at work to just kind of keep you whole.
I love to walk miles and listen to podcasts. I'm an armchair expert. I'm also a 92%er for those of us that listen to New Heights. I'll listen to those podcasts and learn through there and kind of separate or decompress. I also do like to hike, have gone to, national forests and things like that so that I can be able to see perspective in the silence of everything. So being outdoors.
So you and I have talked before. If I recall, you have twin boys, right?
I do.
How old are they?
They are 16. I keep saying they get older and I do not. They keep me young. They keep me active. They keep me tired. They keep my husband and I proud. And really, we're just blessed to have them.
Well, listen, I think Virtua and the communities that we serve are blessed to have individuals like yourself. And I can't thank you enough for everything that you do to make sure that we are here for good.
Thank you so much for having me.
It's been great having another wonderful conversation with one of our dedicated and impactful colleagues. So join in next time for another episode of Here for Good, the Inside Edition.